Hello, my name is Cobb-Phillips. I will be performing a pelvis and thigh evaluation video myself as I do not have a partner. First, I will palpate the location of the dorsal pedis artery, which should be on top of the foot. To palpate the location of the posterior tibial artery, it will be behind and below ankle. Lastly, to perform a capillary refill test, you will first press your finger and see how long it takes for the blood to come back. These tests to see if your veins are working. If it takes too long for the blood to come back, that means something's being restricted in the body. Next, I will be testing the knees range of motion. It's easier with the partner as the instructions stated, but I do not have a partner currently. So first I'll be testing the hip flexion, which is to push the knee upwards and downwards, so you test how strong your patient is. So you have them go as hard as they could against your hand. Next, I will test the active range of motion for hip extensions, hip abductions, hip adductions, hip internal rotations, and hip external rotations. So to test the flexibility for the hip abduction, you should push their leg outwards to see how tight their hips are. It'll be better if your patient is laying down. And then for the hip adduction, you would push your leg inwards to see how flexible your patient is. For the hip internal rotation, you would just twist the leg inward, and for the hip external rotation, you would twist the hip outwards. Here's how to test for the Trenhover test for gluteus medius weakness. You would lift one foot off the floor. If one of their hips goes downwards, that means they might have a weak gluteus medius, but if their hips are straight when you have one foot off the floor, they should be okay. For the Thomas test, it's best if you have your patient laying flat on the floor, you would have them do a knee hug, and if their back lifts off the floor, that means they have hip tightness. And for the rectus femoris contractor test and the Eli test, you would have them lay on their stomach and then pull their leg backwards. If their stomach lifts off the floor, that means they have hip tightness. Lastly, for the anterior impingement test, you would have your patient laying flat on the ground. You would put her knee up, twist at the knee to see if there's any tightness or pain when that happens. For the Ober test, it's to test the iliotibial band for tightness. You would have your patient laying on a sideways position and have them flex their leg, and if they have any pain on the side of your leg, that means it's tight.